Hello and welcome to this Health Suppliers segment here on Health Professional Radio. I'm your host, Neil Howard. Glad that you could join us once again. Now, in this segment, I'm joined by pediatric emergency physician and pain specialist, Dr. Amy Baxter, and she's joining us here on the program to talk about effective non-opioid pain management. She's basically given up her practice to focus on devices that she's invented to block out pain. Welcome to the program, Dr. Baxter. How are you?
I'm great. Thank you for having me. Well,
glad that you could take the time. I did mention that you're a pediatric emergency physician. Give us a bit of background about yourself because that's especially specialized.
Well, and it got even more specialized. So I did a residency in pediatrics, a fellowship in child abuse, then a fellowship in emergency medicine. And as part of my practice, I was particularly interested in preventing physicians from causing unnecessary pain through procedures, through spinal taps, particularly needle pain. And when I lecture physicians on how to block pain, I realized that parents need to be part of this when my own son had a really bad needle experience with his 4-year-old boosters. Mm-hmm. So I invented a device that uses the body's own physiology to block pain. But the important part for me was to try to give parents some control over what pain their children experienced.
What really jumped out at me was the fact that you said using the body to block pain, the body's own mechanisms to block pain. Are you amplifying the body's natural pain blockers?
Sure. So it turns out there's a physiology called gait control, which was written about in 1965, but people have been using this since there were people. If you bump your elbow and you rub it, or you burn a finger and you stick it under cold water, what you're doing is you're using 4 different sensation receptors called mechanoreceptors that are more important to the body in survival than pain is. So pain is a really fast warning signal, but once you've gotten that warning, you really don't need to keep feeling the pain. So if you rub, if you press, if you stretch, if you move, all of those nerves that are called A beta nerves are stronger than the pain signal. So what I did was combine motion to trigger the inhibition that those nerves cause. So for example, what we use is a very high frequency vibration because the sensation of vibration actually hits all 4 of those nerves. Turns out that what's even stronger is if you add another system called inhibitory control, and ice triggers that. If you imagine putting your hand in a bucket of ice water, over time, that sensation becomes so obnoxious that you'll take your hand out. Yeah. But in the meantime, when the brain senses this non-dangerous but unpleasant sensation of cold, it will dampen down all pain everywhere in the body. So you can have your left hand in a bucket of water, but your right hand can have a finger stick, and you don't feel it as much because your brain is inhibiting all that pain. So our device combines the very high frequency of vibration plus an ice pack that freezes solid so the vibration and the ice get simultaneously transmitted. We called it Buzzy for kids because the original prototype that I discovered was a black and yellow muster. So I think that black and yellow probably subconsciously made me think of a bee. And we made a cute little Buzzy bee, and putting it directly where an injection is going to go for about 30 seconds, the ice gets a chance to use that inhibition, and the vibration.
In this injection-specific device, are we talking those little skin pricks? Are we talking muscle injections, finger pricks, any type of injection or specific type?
That I think is a lesson to everyone. I had started with my own specific goal, which as a pediatrician was to decrease the pain of vaccinations. But it's all the same pain nerve, whether it's a burn, whether it's a bump, whether it's an injury, whether it's surgery, all transmitted by the same nerve. So people who were using Buzzy for their Humira injections, their Enbrel injections, their IVF injections, they also started using it for their hip pain and their knee pain because, again, it's all the same nerve. So we had people that began using Buzzy to not take opioids after surgery.
Wow. So it is that effective where it can actually replace opioid therapy for pain treatment after surgery?
So it helps people avoid opioids. The truth about opioids is that they're actually fairly ineffective for home pain management. For example, as a pediatrician, one of the lectures that I would give doctors is that the research shows that ibuprofen is more effective and has fewer side effects, even for home fracture management, for pain after wisdom teeth removal. It's about twice as effective as the codeine-containing medications that people use. So the intense pain that you would get from a surgery or an injury is better treated with the physiologic inhibition, because that's what the body's been doing for millennia. So using a vibration and cold in place of a medication or in combination with ibuprofen is actually a lot more effective. The way that it works is when there's a sharp pain or an injury, putting ice and vibration directly on the place where the injury is does a bunch of things. First of all, both ice and vibration decrease pain, but the vibration increases blood flow, so it can speed healing, and cooling decreases inflammation. So you decrease the inflammation response that comes after an injury when the body is trying to protect the area and the inflammation becomes too much to actually be helpful for healing. So using vibration and cold, you get pain control, you get increased blood flow, but the vibration stimulates repair. One thing that people don't necessarily realize is that the way the body grows is in response to small mechanical stimuli. So if you are pumping iron, if you're lifting weights, if you're even walking, then the bones grow stronger, the muscles grow stronger. You can use those same systems to speed recovery and rehabilitation by stimulating them with a very low amplitude but high frequency vibration.
What about age? Does this work in, say, an infant with these needle pricks as well as, say, a person in their 60s or 70s? You did say adults, but what about our seniors and the sensitivity of their skin?
The feedback loop of the descending inhibitory control part. So it turns out that you're not born with that inhibition loop. Mm-hmm. If you think about children, they're sensitive to mosquitoes and itching. They're sensitive to a tag stimulating them on the back of their shirt. So children don't have the ability to block out sensations that are not providing useful information to the body. Mm-hmm. As you get older, that feedback loop gets stronger and stronger. And that's why this gate control and inhibitory combination we call cool pulse technology, but that's why it actually works better the older you get. The other thing is that infant skin is very thin, and so the ice can be uncomfortable to the point of pain. This is why cold sprays are not good for children, because the intensity of the coldness is too much for the thinness of their skin. As people get older, the ice and the vibration combination becomes more potent. Even for seniors, and particularly for older people, the combination works better because they have had more time to develop this strong inhibition, because their body has learned what's a useful signal and what isn't.
You've also invented VibraCool and Duotherm. Are these all very compact devices? Are some of your devices more compact than others based on the child use, the adult use, the age, any of those particulars?
Sure. So it turns out that the motor that is required to make the very specific frequency that blocks pain, we use one size motor. And so the size of the device that causes the vibration is actually the same whether it's an infant or it's an adult. We have a slightly larger Buzzy in XL that uses that same vibration, but it just spreads it out over about a 36% larger. To get the effect that you want for adults, the ice packs are bigger, and so they transmit the vibration over a larger area. We're working on making an even bigger one for the low back that can incorporate both heat and cold, which is why we're calling it Duotherm, but it is still in development. The other part of this that makes a huge difference, and every practitioner should know about it, is that pain alone is one small signal. The brain has a very sophisticated amplification and blocking mechanism, so fear and the understanding of what's happening both tremendously impact what you're feeling. One thing we've been teaching is pain, fear, and focus. When we first started exploring the Buzzy for needle pain, we found that the more anxious a child was, or the greater the number of injections they were getting, the more pain they experienced, regardless of what we were doing with Buzzy. So part of what we want people to know is you have to address not just pain, but also how much fear someone has and then what they're focusing on during the pain. One of the things with adults that causes increased pain is something called catastrophizing. And after an injury or a surgery, this feeling of, oh no, I'm never going to feel better, my pain medicine's worn off, I can't control this, that leads to a cascade that ramps up the perception of pain itself, because fear and the concept of being out of control are both strongly related to how much pain you feel and how many opioids people take and whether or not they become addicted to opioids after surgery. So what's really important for us is that our device is extremely simple and works on contact. So the VibraCool has a compression cuff with Velcro. It's very easy to attach the ice packs to it, to press the button and turn on the vibration, and then wrap it around in one movement for a knee, an elbow, for plantar fasciitis. So the simplicity of attaching it is really a critical part of why it works. You don't have to mess around with any kind of probes or stickers. It has to be really easy so that the fear and the catastrophizing go away. The other thing is you need to be able to not pay attention to it, because distracting yourself from the pain is a really important part of coping and movement and going on with your daily life.
Well, Dr. Baxter, your devices, your inventions couldn't have been more timely if you had been a time traveler. Where can our listeners go and get some more and much more information about your products and more about you and your company?
Sure. So our company is Pain Care Labs, and so paincarelabs.com is the central place for people to go. And our Buzzy website is Buzzy Helps, because we don't just have the product Buzzy, we also have information about how to deal with the fear of needles and how to effectively use distraction to be part of a full plan for pain, fear, and focus to address needle procedures. For VibraCool, we don't just have vibracool.com, we also have information about drug-free ways to decrease pain. Our mission now is to end this instant gratification, pill-focused culture of pain management and give people real options that are simple to use with serious relief.
And I'm looking forward to getting some more information and to speaking with you again in the future.
Thank you so much. I really appreciate the opportunity.
You've been listening to Health Professional Radio, this Health Supplier segment with Dr. Amy Baxter, talking about her barriers to effective non-opioid pain management, Buzzy to block needle pain for children, and also VibraCool and Duotherm. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au. And be sure and visit our affiliates page when you visit our platform at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.